So my research over the past 25 years has focused on co-creating digital interventions to support people to lead an active and healthy lifestyle, focusing on those facing unique challenges. Through projects with carers, those at risk and with diabetes, office and frontline workers, I've had the privilege of exploring their lived experiences and needs and connecting this with business, public sector, to co-create solutions with meaningful impact. The Wellbot and Sentinel projects are flagship examples of my leadership in delivering scalable and transformative knowledge exchange with international reach. I've also increased awareness and capacity for knowledge exchange through development of new education pathways and events that bring together academia, industry and policymakers, ensuring that research has a direct impact in practice, policy and future innovations.
Hello, I'm James Jamieson, Deputy Head of Curriculum at South Lanarkshire College, East Kilbride. A key part of my role is building strong partnerships between education, industry and our communities. By exchanging knowledge, expertise, we design curricula that responds directly to workforce needs, future-proofing industry, creating work-ready graduates and breaking down barriers and opportunity. One example is the SEECA Academy. Working alongside industry partners, we've developed a curriculum that tackles Scotland's civil engineering skills gap head-on. Students receive high-quality industry-aligned training and every successful graduate is guaranteed a job interview with Tier 1 contractors, providing a direct route into employment. We've also taken learning beyond the campus with a mobile heat pump training vehicle, delivering renewable energy training directly into remote communities. By removing geographical barriers, widening access and supporting green skills development, we're ensuring no region or island is left behind. So that's knowledge exchange in action, breaking down barriers and delivering a real impact for our students, our partners and our communities.
Before joining the University of Strathclyde, I spent over 15 years working in NHS mental health services as a practicing clinical psychologist, leading specialist trauma services for military personnel, their families and frontline staff. That experience drives my commitment to turning frontline insights into real-world change. Today, I lead knowledge exchange across health, emergency services, transport, education and industry, developing trauma-informed digital innovations through co-creation, the part of my work I love the most. Frontline staff once told me I've got no PPE for the mind, and that insight has shaped my leadership in facilitating trauma workshops, developing research partnerships and innovations including Wellbot and Sentinel. I'm proud to work with an incredible team transforming services throughout Scotland and globally, helping position Scotland as a centre for trauma-informed innovation and building psychologically prepared workforces for the people society depend on most.
Hello, I'm Professor Sinead Rhodes from the University of Edinburgh, where I specialise in neurodevelopmental conditions. I'm passionate about engaging children directly about research, such as the National School Competition, Rewrite the Headlines, where my leadership led to 20,000 children learning about science communication. A co-production approach with neurodivergent children, their parents and teachers, has been central to translating my research into sustainable services and resources through a social enterprise spin-out. This community interest company, Epic Think Learn, has developed a digital platform, so far reaching over 20,000 children, their family and educators, with real-world support based on the latest research. Research translation and innovation has created pathways that improve learning, well-being and inclusion for these children and support the adults who care for them. I am passionate about sharing my knowledge around using models like social enterprises to transform research impact.